basically it can help with also cellular structures as well, to help with a little bit of the healing as well if there's kind of some kind of trauma. But at the same time, it's going to be temporary. It's not really going to give you long-lasting relief. It's not going to give you long-lasting benefits. It's a good like associative kind of treatment, but not necessarily something that you're going to need that's going to help you get rid of it for good. Resting too much, doctors say like, oh, you're doing that? Rest. It's fine. Don't worry about it. You'll be better. But it's like, you rest for a couple days, a couple weeks, a couple months. You're still not running out or whatever you like to do after like a year. And it's kind of like, when am I going to get back to this? Your life changes at that point. You don't do it anymore. You've gained weight. You've started losing friends because the things that you like to do, you can't do with them anymore. So you start having those kind of things pop in, and it just really starts to affecting you. So it's not necessarily the absolute, it's more the relative rest for a period of time. Do things that don't necessarily bother you, but still focus on how am I getting back to that? Because if you're not doing it, then, are you really fulfilled in what you're doing throughout your life? Or is there something that's always missing in the back of your head? So passive modalities, painkillers, injections, I would say like chiropractic is great. Acupuncture is great. Massage therapy is great when it's done with the right other things on top of it. So chiropractic is good in the sense that it'll give you the quick, again, lasting relief. Chiropractors are good, but then there's excellent ones that help do appropriate exercise on top of it, but there's not enough of them that do it. And they just have you come to them every week for years to make sure that you keep paying them. Same thing with massage therapy, same thing, similar with acupuncture. Acupuncture does voodoo things, magical things sometimes. But yeah, so it really depends on who you go to as a practitioner for that. Painkillers, obviously, they kill the pain in some cases. Same thing with muscle relaxers. Again, but they mask it. They use chemical processes to block pain signals getting sent. So basically, back somewhat to this, and also back to what we were talking about with the emotional trauma too. It's like if we don't have our brain, we don't have pain. That's the only thing that's the differentiator. So like we don't have that connection to our brain with the rest of our body, we don't have pain. So basically those signals to our brain or back down to our body are getting interrupted at some point because of those medications, but at the same time you're still sending some kind of signal because there's some kind of noxious stimulus that's kind of shouldn't be there, that we don't want to be there, that's giving you the pain. Same thing with injections, whether it's epidurals, trigger point injections, Botox, basically all of them, they'll mask it. Some for a couple days, some for a couple weeks, some for a couple months, but it will eventually come back, whether it's the same or whether it's worse, depends on how long it gave you some relief for. And then obviously doing the wrong exercise. There's a lot out there on Instagram, YouTube, TikTok. There's a lot of people doing a lot of shitty stuff. But yeah, so you got to be careful where you get your sources from, and avoid the flashy things. I would say that sometimes it's the basics that are the best still. So tips that you can do for yourself. So as far as like with your neck pain, do what you can throughout the day. Try to focus on what causes the pain to get worse. Focus on the things that help alleviate the pain, and really focus on doing the things and taking breaks if you need it. So if we're dealing with, for you, I know you're doing a lot with the running events and whatnot, and like you're printing out, I don't know if you print out the bibs or they just get handed to you, or you're sorting through things and you're doing a lot of this throughout the day and you got to take breaks, take a break. Don't let the pain continue to build, and then like you get to the end of the day, it's like, I gotta lay down. Do what you can, take breaks as you need it, because like the more that you kind of stress it, sometimes you'll get to the point where it's just kind of like it'll just start staying there to a bit, just because you've inflamed it to the point of somewhat no return, at least at that point right now. So just definitely take breaks, definitely do what you feel like you need to do throughout the day. Do some range of motion exercise to loosen it. You're probably doing like the lean, typical lean with a little bit of pressure. Yeah. So that's fine too. Just be careful that you're not causing more pain as you're going through it. You don't want more pain as you're going through that, because pain is not harmful. It's a tool. So like use it as your guide if you're noticing that it's getting worse, obviously. Either back off or hold off on that activity for the day, whether it's exercise or what you're doing throughout the day. And then we just need appropriate strengthening exercises in order to kind of heal it, make sure it goes away, and also support the structures around it, especially if we're talking more about the nerve root compressions, if they're herniated disc, spinal stenosis. We want to give it that support so we don't have inflammation around those structures, so that we have the ability to function better. And also postural mindfulness rather than perfection. Sit up straight and do this. Everybody, we start talking about posture and everybody in the room sits up. It's more about not being in that posture for 20 minutes, 30 minutes, an hour. It's more just being able to get in and